I'm Ellie Uday from Occupational Medical Consulting. I'm meeting with Dr. Catlett today and have a few questions for him. Dr. Catlett, you have practiced family medicine, emergency medicine, and occupational medicine. Why did you end up in wellness?
Well, the how and why are kind of a long story. Basically, as part of my occupational medicine practice, I was and actually continue to be the medical director for a large construction company that works up and down the East Coast. They had made a huge impact on workers' compensation costs by instituting a behavioral safety program. The ever insightful CEO basically came to me and said, you know, I think behavior change on lifestyle problems should work for healthcare issues. So why don't we do something like that? And basically charged me with trying to get a shift in the paradigm from claims management to claims prevention by developing a wellness program that changed behavior, improved quality of life substantially, and also impacted spend of the participants. The program got a lot of press, and OMC got into wellness.
Wonderful. So you started as a small company in 1996. You have managed to remain competitive, but there's been a steady increase of other wellness providers in the field. How have you remained competitive?
Well, I think the main thing is because what we do works. We actually do change behavior, we actually do lower risk in populations, and people do actually spend less money, and quite frankly, that's what people that are looking for functional wellness programs are looking for.
So what is the secret to your success?
I don't know if I should give it away. I think a major secret is the use of motivational interviewing. We train our coaches and support them to use this incredibly functional tool that really does work in changing people's behavior. We also focus very strongly on helping people adapt cultures to support the changes once they're made. We've been pretty innovative in figuring out ways to get to hard-to-get-at populations of scattered mobile employees and their spouses. We do a lot of quality assurance on everything we do. We're always trying to make sure that the coaches are functioning as we say they're functioning, and we're delivering the product we said we were going to deliver. We check basically everything. We track everything we do and are always looking for ways to improve.
Can you share some of the results of your Wellness Works program?
Sure. An interesting fact is that 24% is the number that comes to light when we look at the average of all our companies and what happens to high-risk behavior in the first year. We were able to reduce that by 24% on average in every client. Our largest client has experienced, from the graph you see above, from 2006, I believe, until 2011, experienced a $1,395,000 average per year decrease in spend because of the lowering of risk levels to those that spend less. This is all checked by Cigna data. We look to see what we actually spend every year and compare that to what we would have spent if we had not lowered risk in the population. We have 80 to 90% participation rates. We have 80% participation rate in a condition management program delivered by the health coaches and supervised by an RN. And virtually all our companies see a reduction in spend, or at least a move toward flat within the first 2 years of the program. The other slide you see up there shows that initial construction companies' experience with healthcare costs over over several years. And what you see basically is that the green line is something where you would want to be, because that's the actual spend. And although it increased at nowhere near the rate that the insurance provider anticipated, which is represented by the red line. So substantial change in trend there. The other thing I think is important to note is that the per employee spend trend since 2001, the beginning of the Wellness Works program, has consistently been negative.
Oh. So what are the biggest challenges then to worksite wellness?
I personally think the biggest challenge is the lack of definition of wellness programs. I'm very concerned that wellness programs get lumped together as a group to be compared, and then the outcomes are not very flattering in many circumstances. I think it's important that wellness programs be redefined by their outcomes, by the intention of their outcomes, and then compared as groups so that we can really see which programs work and don't. I think a big challenge remains in getting to small business. I think that's a very significant challenge for the future. And I think improving ways to get to these mobile populations and spouses, because spouses spend half your money, is going to be an ongoing challenge in the future. I'm glad to say that at OMC we've revamped our programs recently to allow us to, I think, adapt to these challenges quite effectively.
Good. Thank you for your time this